Hi, good afternoon, and welcome to another episode of Black Health Unfiltered. My name is Dr. Keem Stewart, here with the wonderful.
Rachel Sinclair.
There you go. So, welcome to another episode at the program where real conversations meet real solutions. Broadcasting live on Love Bay Radio, we dive deep into the stories, struggles, brilliance, and resilience that defines Black health across the diaspora. This is a space where nothing is off limits, from mental wellness to medical myths, from community healing to the systems that impact our bodies and our futures. Guided by experts' insights, lived experiences, and unfiltered truth, we are here because Black health deserves clarity, power, and a platform. So let us elevate this conversation and reclaim our narrative one episode at a time. I hope everyone had a wonderful week. It's been really odd weather over here in Ontario. We've had up and down all the way around. We had extremely hot days with surprise thunderstorms and
Yeah,
heavy
those
rain.
were a huge surprise.
Yeah, a lot of people without power for a little bit, a little
Hmm.
bit of flash flooding. Canada they came. Everyone was expecting fireworks, and all of a sudden, clouds started rolling in, looking like a doomsday parade. But we're here. It's sunny today. It's a little bit cooler, and I guess we're in the full swing of summer. So for all those up there in your swing of summer, remember to hydrate. Use your sunblock. It's very
Hmm.
important, right? The same. I keep telling people the same sun that our ancestors dealt with is not the same sun that we're dealing with today.
Mm-mm.
You can get skin cancer. So please use your sunblock. Uh,
SPF.
use your SPF over 50 if you can,
Hmm.
right? And make sure you protect yourself. So, Richard, we have a packed show today, and we're speaking about uterine health, and because as it is uterine fibroid month, right? We really want to take to expand over a four-part series of talking about fibroids, talking about all the different complications and
Hmm.
its manifestations, endometriosis, so on and so forth, hormone imbalance, and we'll be talking about these things over the next 4 weeks.
Hmm.
Really taking a deep dive to explain and take time to give knowledge, right, on what persons may be dealing with, what persons may have around them that they may not understand, and the possibility of these things actually developing if not done or you don't take the preventive measures as you can.
Hmm.
In the Black community, we all know someone that unfortunately suffers from fibroids, and it's really not a nice complication to have to live through, especially with the hormone imbalance and the pain that it can bring when it comes to menstrual cycles, the
Right.
complications that it brings to when it comes to fertility. It really is so much, and it's never the same manifestation, or it doesn't present itself equally every single time.
Yeah.
So, I mean, if we could start with a little bit of statistics today, 4 to 5 Black women will develop a uterine fibroid or will develop uterine fibroids by the age of 50, and often a decade earlier than their other counterparts, other racial groups. And
Hmm.
often symptoms severe enough to disrupt work, relationships, and mental health. And yet, fibroids are still treated like a footnote, unfortunately. Just heavy periods, just cramps, something to push through instead of something to treat. So, this July, for Uterine Fibroid Awareness Month, Black Health Unfiltered, as I said, we're going to have this four-part series to change that and have that conversation. Let's break that silence, right? In part one today, we're going to be laying the foundation on what fibroids actually are, what they do to the body and the mind, and why this is a Black health equity issue as much as it is a gynecological one.
Hmm.
No guests for this episode today, so it just won't be us, Rachel and myself, breaking it down the way we would wish someone had broken it down for our mothers, our sisters, our partners, and ourselves. So if you've ever been told your pain was normal, this one is for you, right? Remember today, guys, if you want to join in on the chat on YouTube, you can, or you can call in 437-778-3299 on WhatsApp or local. That we can also have a conversation through there. So, I think first off, we're going to hit off of what fibroids actually are. And Rachel, ask for your, this is an opportunity. I don't really get to do this often. But in your opinion, what are fibroids?
Oh gosh. I think let me get technical. Let me start technical and then let me go in terms of what my own personal interpretation is. But if you were to open up a medical textbook or talk to your doctor about this, they're more than likely going to tell you that they're considered to be non-cancerous growths, and they're made of smooth muscle and also some fibrous connective tissue. And so the two things come together and they form around in and around the uterine wall. So it's the most common type of pelvic tumor that people with uterus would have, but the word tumor doesn't often get used simply because it's so alarming. But the majority of them are actually considered to be benign and never really become cancerous, but they still have a significant impact on the lives of women everywhere. And part of that issue and part of the lack of understanding and the lack of knowledge that's often um, not shared amongst women is because of the fact that there is not a lot of them turning out to be cancerous.
Yeah, and that's very true. So fibroids, to give what you hit the nail on the head. Uterine fibroids, specifically also called myomas or leiomyomas, are non-cancerous growth made of smooth muscle and fibrous connective tissue that develop in, on, or around the uterine wall.
Hmm.
They're the most common pelvic tumor in people with a uterus or women. And despite the word tumor sounding so alarming, the overwhelming majority are entirely benign, and thankfully they never become cancerous. So they do
Hmm.
have a little idea. So when we talk about the size and the range of it, fibroids can be as small as a seed, right? And we could also differ between fibroid and a cyst, but let's a fibroid and a cyst. But let's just keep on the ideas speaking about fibroids today. So they can be as small as a seed,
Hmm.
undetectable without imaging, or grow to the size of a grapefruit or melon. So imagine like you got something as small as this, and then you could have
Hmm.
something that big, large enough to to visibly distend the abdomen and be mistaken for pregnancy. In
Hmm.
rare extreme cases, a single fibroid or cluster can weigh several pounds. So when we look at number as well, some people develop single solitary fibroids, others develop dozens simultaneously of varying sizes at different stages of growth. It's common
Hmm.
for new fibers to develop even after others have been treated or removed. So, for those that may have gotten them removed and then they come back, like, oh, we don't understand, it's not uncommon for them to come back. So, it is very important taking the stages of doing what you can, balancing hormones, weight, whatever. And we're going to get into that as we can as a
Hmm.
series, but just understanding that having them removed doesn't necessarily the butt doesn't stop there. The work still has to continue to maintain that they don't come back. And
Hmm.
then we're looking at location, which this matters enormously, right? Fibers are classified by where they sit relative to the uterine wall, and location is often a bigger predictor of symptom severity than size. So, though you may have a small fibroid, as small as a seed, its location and where it sits really does determine how severe it would be than it being different to someone who may have a fibroid as big as a grapefruit, right?
Hmm.
So there's submucosal fibroids, which grow just under the lining of the uterine cavity and protrude inward. Even small submucosal fibroids tend to cause the heaviest bleeding and the most fertility disruption because they distort the uterine lining directly.
Hmm.
Intramural fibroids grow within the muscular wall of the uterus itself. These are the most common type and can cause the uterus to feel enlarged or bulky. And subserosal fibroids grow on the outer surface of the uterus, sometimes on a stalk, which could be pedunculated. All right, pedunculated. These are less likely to affect bleeding, but can press on the bladder, bowel, or other pelvic structures, causing pressure symptoms. And then lastly, we're going to look at prevalence. It's estimated that most people with a uterus will develop at least one fibroid in their lifetime. Many are asymptomatic and discovered incidentally during an unrelated ultrasound, pelvic
Mm-hmm.
exam, or during pregnancy imaging, meaning a huge portion of the population is walking around with fibroids they don't know about, while others are living with debilitating, undiagnosed symptoms from the exact same condition.
Which is crazy to think about, right? Like symptoms can impact are impacting women so differently, and a lot of them are walking around with fibroids that are causing them pain, and they're changing the way that they're moving about in the world and affecting their life, and they don't even know that that's the cause. And unless they're getting some type of screening or some type of test, and it just so happens to pop up, that's how a lot of women are finding out.
Yeah, and when you sit down and think about it, like what can you really do? Can you constantly go and say, "Hey, I need imaging all the time to make sure I don't have fibroids"? It,
Mm-hmm.
it's it's not something that you can readily just say, "Okay, I need this, I need this, I need this" to stay on top of it. And unfortunately,
Mm-hmm.
you don't know until it's too late. But then that's why it's so important to make sure you get your checks every year, right? If
Yeah.
you're a gynecologist, make sure you do your yearly gynecological checkup. Make sure that you go in if you want to have and your pap smears every 2 3 years, right? Make sure you do all of those necessary steps
Mm-hmm.
to stay on top of your just not only your physical health, body wise, but your vaginal and reproductive health.
Mm-hmm.
And it's easier said than done because not
Yes.
everyone has a gynecologist, not everyone has a family doctor. But these are some of the things when you do have the opportunities that you need to keep in
Mm-hmm.
consideration, right? Or take into consideration. So I guess after we speak about all those things then and taking those things into consideration, we have to understand first, before we even go and ask these questions at a consult, what actually causes fibroids,
Mm-hmm.
right? And a lot of a lot of literature out there. Let's say a lot of
Yes.
different things.
Yeah.
We could talk about when it comes to Black women specifically. I remember
Mm-hmm.
years ago that they said fibroids were more prevalent in Black women who straighten or perm their hair, right?
Mm-hmm.
Permanently, and because of the hormonal disruptors that are found in or the chemicals that are found to help straighten the hair. That's
Mm-hmm.
why we constantly say that trying to live to a Eurocentric beauty standard should never be the case for you because it actually does more harm than it does
It's
good.
very dangerous and a lot more dangerous than people think it is.
Exactly. But and then it's also hard to look at a woman and tell her like, "Hey, wear your hair natural because it's best." But then when you understand the amount of hair care, the money, and the products that you gotta put in, sure the moisture is there and all that, and it's very
18 moisturizers. Yep.
different moisturizers. It's I've walked in the beauty display store maybe twice this week, and everyone walking in is like, this is overwhelming because how do
Mm-hmm.
you know which is what? So it's a catch 22 when you look at it, but then you have to wager what do you want more? But those are just some of the things that are said like loosely, right? But if
Mm-hmm.
you really dive deep into them, like the research is, you have to realize the research base that exists is still genuinely evolving,
Mm-hmm.
right? And overstating certainty will undercut the credibility of what it is. So for those listening to what can cause, this is still developing research. Nothing has been set in stone, but these can be considerable factors that do affect
Mm-hmm.
persons um, with the uterus to be able to in developing or being stricken with fibroids, right? So we're looking at hormonal drivers. Straight off the bat, we have estrogen and progesterone
Mm-hmm.
are understood to fuel fibroid growth. Fibroids typically grow during the reproductive years when these hormones are highest. They tend to grow faster during pregnancy and typically shrink after menopause when hormone levels drop. This is also why hormonal treatments are a common first line management approach. We
Mm-hmm.
have genetic and familial risks. Having a mother or sister with fibroids meaningfully increases a person's own risk, suggesting a hereditary component that researchers are still working to fully map at a genetic level.
Mm-hmm.
Age. Risk rises steadily through the reproductive years, typically peaking in the late 30s through 40s, though fibroids can appear earlier. Over other contributing factors sometimes discussed in basis of research. So we're looking at body weight, we're looking at vitamin D levels, and that is
Mhm.
actually very recent. Um, there are findings that persons who use or supplemented by vitamin D has seen significant reduction in fibroids. And I've said it many, many, many times on this podcast. We need a saturation of 30 to 40 minutes every day in the sun for us black people to get therapeutic levels of vitamin D developed in our body.
And for those of us who live in cold countries like Canada, you know you're not getting that most of the year.
Let me start it. Supplement will go outside for 30 because the sun hot. The
Yeah.
sun is hot. It's hot outside, so people are in the shade.
Hmm.
But and it's not like you just put your hand outside and it's like 30 to 40 minutes and you're good. No, you have to literally be outside, fully immersed in the sun for 30 to 40 minutes
Yeah.
to get your vitamin D therapeutic levels. There are times that if you get up extra early in the morning before it gets too hot, between 6 to 8 a.m.,
Hmm.
right? Or if you go late evenings, right, where the sun is going, but it's just enough. So between 4 to 6, depending on where you're situated. Let's speak about the Caribbean more, depending if you're situated a little bit later in
Hmm.
American African countries in the summer months. But majority of us
Hmm.
in the black community, we're not doing that, right? You're not finding yourself outside. So if you are, perfect. But if you aren't, then you need
To supplement with
to
some vitamin
supplement
D.
your vitamin D. And vitamin D should be supplemented with a fatty substance. So when I say fatty substance, I'm talking about omega-3 or with food. So when you're taking your vitamin D, please take it with food or with fatty oil substance. It could be omega-3, it could be olive oil, it could be avocado oil, because vitamin D is fat soluble and you need it to be for it to be absorbed in the intestine. It needs to have a fatty substance to go with it to make it soluble enough for
Hmm.
absorption. All
Yeah.
right, that's just a small tangent on the side, but they've seen that vitamin D levels, specifically low vitamin D levels, have contributed to development and growth of um, fibroids
Hmm.
and diet as well. And we've spoken
Yes.
about diet 100%. We talked about fiber, increase fiber up to 25 grams for women. It's so important because you excrete excess estrogen into the stomach for it to be, not stomach, sorry, into the intestine for it to be taken away. That's taken away, absorbed and taken away by fiber. If you don't have significant enough or significant amount of fiber within your intestine at the time, the body will reabsorb it. And with that reabsorption, that's where you get a hormonal imbalance. This is also very new literature that and findings that persons are seeing.
Hmm.
So researchers are discovering. So is in its beginning stages, we're seeing that if you increase your fiber, you can help yourself bring down your um your hormonal imbalance issues, especially when it comes to estrogen levels.
Hmm.
So that's something else as well to take into consideration when we think about diet. Talking about antioxidants, you're thinking about the level of fiber, you're thinking about hydration as well, making sure you're getting your electrolytes, your minerals. And I know it sounds like a lot of work, but if you catch a groove, right, where
Yeah.
you find where you can supplement on what you can get in whole foods, then it becomes a lot easier because life becomes easier due to you being able to reach equilibrium,
Hmm.
right? Or a sense of
Yeah.
homeostasis in the body.
100%. It's just a bit of a it's a bit of an accessibility issue in terms of being able to afford those supplements and to be able to afford those nutritious whole foods, not just for yourself, but for, your mother, your sister, your auntie, whoever else you may be providing for too, right?
Hmm. It's an investment, and
Yeah.
maybe I'm not going to say that I speak from a place of privilege in
Mm-hmm.
that sense, because I rather sacrifice,
Mm-hmm.
right, what I can to make sure I can still get those type of supplements in. But then I guess I do. I'm speaking because I'm not. A lot of circumstances I'm not living where other people live in. So like, if it is a possibility, you have a village and you can, please, like
Help your
something
villagers.
nothing. Something is better than nothing. I'm not
Mm-hmm.
asking you to go and buy the whole house store. I'm asking you to speak with your family physician,
Mm-hmm.
speak to someone, and see what actually you can do, and then you can start there. So every small step towards the right direction carries you where you need to be.
Mm-hmm.
Right? You don't have to sprint there. Sometimes it just takes a shuffle, and then shuffle becomes a glide, and the glide becomes a walk, and the walk becomes a run, and the run becomes a sprint, and now you're at the end. Right?
Mm-hmm.
So all these have been studied as potential contributing or protective factors, though none of these are considered definitive causes on their own. Just solely, as I said, a lot of this research is pretty new. So
Mm-hmm.
that, and then we're looking at something that's really big, the equity gap in research itself. It's worth naming directly that the scientific understanding of why Black women are so disproportionately affected, not just hormonally, but potentially at a genetic or environmental level, is still catching up to the scale of the disparity.
Mm-hmm.
This isn't a minor caveat, it reflects a broader pattern of underinvestment in research specific
Yeah.
to Black women's health outcomes. So, this is also one thing you have to consider that a lot of research doesn't reflect us, our group, or the women within Black community. So a lot of the information you may be also gathering online, you have to be very careful what you gather because a lot of it is being told from a gaze that does not carry your shade of color.
100%. And taking that into consideration for not just, you know, exploring what's causing fibroids, but also what the physical effects are and the symptoms that people are going to be presenting with. Because as you start to consider, you know, other demographics, speaking specifically for Black women, you start to consider them more, that list may change. But in terms of just sharing that information for you guys, we want to kind of go through some of the major ones to be aware of, to not only for yourself but for, the other women in your family, and also be able to take this information back to your physicians, your primary care practitioners, to be able to have a conversation if you feel like some of these things are resonating with you. So, one of those big things when we're thinking about symptoms and physical effects is heavy, prolonged periods, which is also known as menorrhagia. So, those are periods that last beyond 7 days, require you to change your tampon, change your pad more often than what is considered to be average. So, talking about every hour or two, you may be passing clots that are significantly large. That's the most disruptive, commonplace symptom when people are thinking of fibroids and how it impacts their bodies. And then the next one would be talking about anemia, so specifically around that significant iron deficiency. So all of that blood loss over months and years will deplete your iron stores, and that leads to things like fatigue, dizziness, shortness of breath, constantly feeling cold in your hands and your feet. So if you're like rubbing your hands together, rubbing your feet together, finding that, when you're lying down in bed at night, all of you is comfortable, but your feet are freezing and your hands are freezing, that's a sign that your iron levels are very low. And then also adding on to that, that difficulty with concentrating. So a lot of those symptoms often get misattributed to stress, lifestyle, or just constantly being tired, rather than being connected back to that blood loss, which would be connected back to having fibroids. So you see how very quickly, when you shift your perspective a little bit, thinking of these symptoms and opening your mind to consider the possibility of having something like fibroids, how it changes the perspective or changes the landscape of what you're looking at a lot differently. Because those symptoms that I just mentioned, a lot of people would just attribute them to, oh, I'm just always tired, or oh, I just need to, eat this or eat that, when there's a bigger issue at play that they may not be aware of. And then another one to consider as well is significant pelvic pain and pressure. So when you're feeling a consistent heaviness or ache in your lower abdomen or in your pelvis, it's almost described as like a dull, constant pressure rather than a sharp pain. And then lower back pain is another one. So those larger fibroids that radiate into the lower back that we talked about before, they can mimic just muscular pain, and that often gets misdiagnosed as just chronic low back pain when it's a symptom of a broader issue, right? There's also abdominal bloating and distension. So with those larger fibroids, not only can you have a lot of pain in your lower back, but the abdomen can also become bigger and like protrude more, which leads to people getting asked if they're pregnant when really it's the fibroid that has just grown to a significant size and is now pressing up against other structures in your abdomen and making it larger,
So
right?
this is one time, not to cut you to Rachel, that it's very important that you just don't assume someone is pregnant. Just
Yeah.
don't say, "Hey, when you're expecting," because it's very difficult when someone may have
Hmm.
a fibroid and you're asking them if they're pregnant,
Hmm.
and that person could also be suffering from fertility issues, and now you're saying that they look pregnant, and now they know in back in their head that they're having difficulties getting pregnant, and now you're like, "Huh," like
Hmm.
be very
Be
very
mindful. Be
mindful
mindful.
about how
Yeah.
you approach persons. I mean, just wait till someone tell you. If
Hmm.
they're showing and it comes and you notice, they're gonna say they're happy to be pregnant, but like in those times, especially
Hmm.
our community, we tend to say, "Oh, you getting so big, or you poor thing, you ain't fat, you must be thinking, one, are you pregnant?" No, stop it.
No. Stop.
Don't
Yes,
do it. Like, be
absolutely.
mindful of that, right?
Hmm.
Especially, I just wanted to plug that in there because I've heard it many times where a person say, "You don't mind your business," right?
Yeah.
So,
Yeah,
just
your disclaimer highlights my anecdote that I was going to share, which is that I had somebody who is living with fibroids and who does have that specific physical impact with the larger abdomen, that it's been a struggle of theirs, not because not only are they struggling to get pregnant, but they also are appearing pregnant. And so people keep congratulating them and asking them about when they're due and things like that. But it's, it's such an already sensitive topic for her, so to have to um, dismantle those stories and those assumptions on top of dealing with what she's already dealing with. She talks about not wanting to go outside, not wanting to go to the grocery store, like just wanting to be at home because she doesn't want to be seen and have to deal with those difficult questions. So yeah, that mindfulness piece is really important, especially for something as sensitive as this. And in addition to all of those physical impacts that we're talking about, you also have urinary and bowel symptoms. So, pressure on the rectum or the bowel, and then pressing on the bladder. So, with the pressing on the bladder, you might find that you're going to the bathroom a lot more, constantly feeling like you have to go, or having a hard time fully emptying your bladder. So if you find that you're sitting on the toilet and you've gone and then a couple of minutes pass and then you feel like you have to go again, that is a sign to kind of be mindful of, that maybe you need to have a conversation with your doctor. And similarly, having those fibers pressing on the rectum or the bowel will cause constipation or that feeling of fullness and trying to go to the bathroom, but you're just not able to. Mm-hmm.
and then we have just to finish it up, we have pain during intercourse, right? And depending on the fiber location, sexual activity can become painful, which
Mm-hmm.
often is unspoken due to stigma. Not only stigma, but like due to where persons may find their levels of pleasure and what they think is pleasure. It's good to keep into consideration that not all pain is pleasure,
Mm-hmm.
right? If you are feeling uncomfortable, it is not, and I'm going to be very frank, it's not nothing normal the cases. It's
Mm-hmm.
very, very important at that point in time to like, hey, stop. This does not feel correct. Know your body. This does not feel correct. I need to go and get this checked out. And
Mm-hmm.
that's very important to consider as well. And we have our fertility complications. I know we touched on that, right? So submucosal fibroids in particular can interfere with embryo implantation or
Mm-hmm.
increase miscarriage risk by distorting the uterine cavity. So those that can happen as well. So very important, as I said, if you do have fibroids, or making sure that you can get those checkups with your gynecologist or your family doctor yearly. Really good, especially if you have a familial history uh,
Mm-hmm.
when it comes to this. And then we have pregnancy complication. So fibroids are associated with an increased risk of preterm labor, abnormal fetal positions such as the breech position or breech presentation, and higher likelihood of needing a C-section delivery.
Mm-hmm.
So these things as well happen. So when those persons, when you're looking to get pregnant, and like if you actually have the time to say, okay, I'm planning for pregnancy this year,
Mm-hmm.
right? Because not all pregnancies happen planned when we have these situations that they may not
Yeah.
happen planned.
Mm-hmm.
right? But those in that opportunity to say, okay, we're looking at SPEC, please take the time to go through the genetic testing. Please take the time to go through um, having a conversation with your family doctor and doing all the necessary tests to make sure that your body is aligned and ready for
Mm-hmm.
pregnancy. Because that does take a high level of preparation before the actual act, right? And I know, I think we are living in a world where things have become so complicated. It's not as simple as it used to be back in the day. We were saying, well, my mom, my grandmother, whatever the case is, it was just boom, yeah, we was ready to become a kid. But no, we live in a world that we should take our the necessary steps to make sure that we're ready for
Mm-hmm.
what comes with pregnancy, especially for women, as with all the complications that actually can occur,
Yeah,
right? Knowing that we can actually see it before it happens to somewhat a higher degree than it was 20, 30 years ago. So,
absolutely.
mhm. So and I know that was a big long list of the physical effects, but I don't think they're too far off of where a lot of people would have had experience. But I
Yeah.
also like to remind our listeners that they listen to Black Health Unfiltered on Love Bay Afrobeat Music Talk Radio. Please subscribe, like, share, download our apps from the Apple App Store or Google Play. Visit our website and tap the donate button to make a contribution to as this helps us continue serving you, our community. And if you'd like to be part of today's conversation, please reach out to us at 437-778-3299 or join us on the chat on YouTube as we are streaming live at the current moment. So I think now we were talking about the silence. Now, if you're going to really talk about the silence around what fibroids can happen, I
Mm-hmm.
think or what fibroids do to us, we need to talk about the effects that people don't talk about enough, right?
Right.
And I think that we should take a little bit of time on this part as well. We're looking at the mental and emotional load first off and foremost when we really speak about fibroids, right? Constantly having to plan life around an unpredictable heavy period. This is where you can't go out because you're not too sure if you may bleed through your pad, or you bleed through your tampon or your diva cup, whatever case you may use,
Mm-hmm.
and soil yourself, right? And having to plan like, okay, do I double up, triple up, so I can be able to go and sit down and have dinner with my friends, right?
Mm-hmm.
Having to choose clothing carefully. Okay, I can't wear white. If I wear white today, it's a bad day. I got to use something. If I do bleed through at least one show, right? Mapping out bathroom locations in advance, canceling social plans because the pain is too much,
Mm-hmm.
right? Or it's just too heavy for you to go, and you can't focus to do anything. Avoiding light colored clothing and carrying a low grade anxiety but bleeding through in public.
Mm-hmm.
Constant. That is of an emotional load. So that really does affect your social life. And we're social beings. So
Mm-hmm.
you may choose to stay in rather than go out. The isolation of normalized suffering is another thing that we have to take into consideration as well. Many people assume debilitating pain and bleeding is simply what a period is supposed to be. I'm gonna say something that a lot of people, I've said it before, and first last person I told it off, they said, "Don't piss me off." But I never said it, right? But the healthiest form of you having your menstrual cycle shouldn't last more than 3 days. It should be 3 days for your cycle.
3 days.
3 days. With cycle, technically, if in all, I know most give to 5, but like the brunt of the cycle itself should be 3 days, right?
Mm-hmm.
But we've come to a point where it's like, okay, it's all right if you have it for 5, if you have it for 7, if you have it 8, 9. Oh, just my period lasts a bit long, whatever. It's spotting here. We've normalized it so much, right? We've stepped away from what it is because there's so many things that have happened, so many disparities, so many complications that have happened,
Mm-hmm.
right? With the introduction of all these different types of contraceptives and hormonal treatments and
Yeah.
all
Well, I
the
was
different.
just about to say, I think the introduction of those contraceptives, especially things like the IUD, the hormonal ones, right? They adjust your barometer for what is now considered to be your normal. So
Exactly.
if we have a bunch of women that are getting these IUDs inserted, then all of their normals will shift, and then collectively we may be looking at a new normal. So somebody who does have a shorter period cycle, that is only for the brunt of it, as you say, 3 to even 4 days,
Mhm.
whereas now all of those women may be looking at something that's more like 11 to 12, like longer, with all the when you're taking into consideration all of the spotting.
Mhm.
That's now a new normal
Yeah,
for them.
and that's what it is. And when you really look at it, and as I said, my friend told me don't piss them off. I'm like, but it's so that's textbook. That's what it's supposed to be. And if you look, a lot of women do have periods for 3 days, and most women call them God's chosen favorites, right? But there's so much, and there's a lot of things when it comes to stretching the pelvic floor, doing your pelvic floor exercises,
Hmm.
getting make sure you're getting electrolytes, staying on top of your iron levels, and doing our strength and work like strength building exercises. They actually lower the pain that occurs during the cramping and so on and so forth. But that's for another episode. I would not go into that. We're focusing on fibroids. But if you really think about it, I'm just setting the foundation here that the pain that being as debilitating as it is and not
Hmm.
bleeding
Hmm.
is simply what appears is supposed to be. This is actually not what it is. All right. And this happens because people weren't told otherwise, whether it be by family, peers, or even providers. This normalization delays people from ever seeking help in the first place. So if
Hmm.
you realize that that is the oh my I can't do anything for the day, I'm staying vomiting, but like that is not what it's supposed to be. You're not supposed to have to live through that. There is a space where it isn't as debilitating as that. And many may not reach it because it takes a lot of work to get there, right?
Yeah.
But understanding that it is there, knowing that when these levels of pain are so high that you just can't do anything,
Hmm.
that that should just like turn the light on and say, okay, you know what, I need to go and seek help. I need to go out, talk about this. I need to ask a question because it could be a little bit more than just regular period pain, right? But it's really not supposed to be that for women. And this is not me. Let me also preface this. We're not saying that I'm trying to lower the experience of what is a period, right? And pain that person's going through. No, I understand. It is still painful, right? It's just the shedding of a lining, right?
Hmm.
It's nothing easy about that. Just understand that that pain level, that being that high, is not the normal, right? And if it is that and it's really affecting you, please bring it up to your family physician, speak to your gynecologist about it, because there may be something underlying that you
It's
are not
causing it.
and that could be causing it, and you can actually get to it to make it easier for yourself, maybe in lower down or actually getting ahead of something that might be developing or have been developed, and you could actually give it a chance to bring it back
Hmm.
to dealing with it before it gets even worse.
Right.
Right. So then we're looking at also the toll on work and daily functioning. We have like missed work days, cancel meetings. That's why, what was it? Is it Italy? I think so. There was some country in Europe that were giving like those days off of for the women in their one company that do go through the menstrual cycles. They get a couple days
Yes,
off for their thing.
I
No,
heard about that.
big up to them because it's still needed. Though I just said that the normalized pain is not nothing, that doesn't mean that those who actually might be sitting on those 3 days don't still need a little time off to just think. So like I think that's something also should be thinking. Like I think it's a big robbery that women have to pay for tampons, but either ways, um, because it really can't stop it. You really can't do it. It's just, women pay for tampons is not it
Yeah.
should be a thing. Should be somebody
Yeah.
given because you really can't stop them.
Personally, as a rule of practice, I carry multiples of different types of like menstrual products. So pads, tampons, like I carry them not just for me, but just to be able to provide that for a girl. And it's come in clutch for me so many different times. I
Shouldn't be
can't
so
tell
expensive.
you.
It shouldn't be so expensive because you guys you can't not
Not
do it
have a period,
or
yeah.
have to unless it's a huge hormone imbalance, right? It's not
But
something
we
you
don't
can't
get to opt out of it.
exactly. It's like I wouldn't say it's very similar to being tall and going on a airport and a
And
flight.
wanting a first class seat because you
I
need the
want to
leg
see
room.
them actually fit behind for some type of leg room. If not, you got to suffer through the whole thing, right? Like, but you got to pay for being tall, right? So you got to pay for being a woman, which is, or having a uterus, which is unfortunate. So they tell me, well, you having a uterus is a choice. Another conversation for another day, but it shouldn't be that. So like having to miss work days, cancel meetings, and using vacation or sick time specifically to manage symptoms, often without ever disclosing the real reason to the employer, this is not fair,
Yeah,
right?
because you
That
shouldn't have to
you.
disclose that. It
Mhm.
shouldn't be a point of contention or point of issue. But I can say personally for myself, there have been days where the symptoms of my period were so severe that I was not able to go to work. And in certain situations, I was reprimanded for it and I was questioned about why I wasn't there and all of these things. But I shouldn't have to feel pressured to disclose personal medical information to you in order to get some grace for not being able to be at work on that particular day.
Exactly. And then they have the toll on intimacy and relationships, right? So like the pain during sexual intercourse, self-consciousness about both bloating and exhaustion from anemia
Hmm.
can quietly strain romantic relationships in ways that really get discussed openly, because now you have to hope that your partner understands.
Hmm.
And not every man is going to understand. I'm lucky. I grew up with my mom, my sister. So like my sister made sure that even before I went into to medical school, to learn about these things, like she was like, "Oh, you gonna learn about this. You can hear about this. You can think." So she drilled all this information. So a lot of these things that I'm referring to, I
So,
learned.
so Kim is the reason why you're a good doctor. Shout out to Kim.
Kim is the reason why I
Shout out
know
to Kim.
so big up. I told you she's my best friend, right? But these those things, you have to hope that your partner have that education. If not, you're always thinking, okay, when I go into a relationship now, like I gotta hope, I
Hmm.
go, maybe I can't, don't worry to pursue it because he may not have that maturity or understanding or grace. So those are things that doesn't help as well for women in those situations. So it's hard on them. So now we just adding about the things that are we're adding on to the things that really add on to your cortisol levels and your psychological load and the
It's all
depression.
connected, right? It's all connected. We're just talking about the layers a little bit more in depth.
Exactly. So we keep adding on. So another thing, we got the dismissal in clinical settings, right? So being told by a provider who may not even have the opportunity to actually learn firsthand and just reading the book and don't have an equitable lens, that heavy bleeding is just how your period is. But remember what I just told you, right? That the pain doesn't warrant further imaging, but he doesn't understand. He or she doesn't understand because they haven't had that training to know that equitably that it affects in Black women a little bit more than it does their other counterparts in other racial groups.
Hmm.
So, are having concerns minimized during the appointment, right? An experience so common among Black women, specifically that it has become a recurring theme in patient advocacy research. How many times do you hear it, right? I remember a story of this one lady. She was she was a fellow on a resident under her attending, and this lady, she dressed up really really nice to come to this hotel. She wore a small heel, and she came saying, "Oh, I'm having a lot of back pain." And the doctor was like, "Oh yeah, she's lame. She just want medication because if you got back pain, where you gonna wear heels?" But the woman only realized a couple years later that this lady dressed up in her Sunday's best to come to the doctor, hoping that she would not be um
Dismissed.
dismissed, hoping that she would have the opportunity to have a conversation where someone would take her seriously because she came dressed
Yeah.
as a functional person in society. But yet, within that, there was still racism and bias that existed in that aspect.
Hmm.
And these are things that happen to Black women a lot.
Yeah.
So that dismissal in clinical settings, a lot of people just avoid not going in the first
Hmm.
place because they don't think they're going to be heard. And
Yeah.
that's the unfortunate aspect. And then lastly, we're just going to talk about the diagnostic delay. So by the time many people receive an accurate diagnosis, a real treatment conversation, they have often been managing after a real treatment conversation, they have often been managing a severe disruptive symptom for years.
Hmm.
Sometimes having seen multiple providers being before being even taken seriously.
Hmm.
And then you finally get the ability, but like sometimes it's a little bit too late
Yeah.
when it comes to that. And that's the unfortunate aspect of it. And it's not fair that that's the system that we live in. That's why it's very important, if you can, Find yourself a black doctor, adopt someone who looks like you, someone who understands and that have practice. You could see some type of representation in the office that you're walking into. It is very important, right? Representation matters. It will always matter. It will continue to matter,
Mhm.
right? So for those young ones out there who think that it can't be a doctor, you can very much so, right? Dedicate. Must understand parents that it does not take this the individual to be a doctor. It takes the village around that individual that
To
helps them
lift them up and give them that support.
because it takes days where you something cut off, you can't do anything, you can't cook for yourself, you can't maybe hold up your end what's in the house because they have to study. But understand it takes a village. All right. So we see it now that more individuals are going into the system, are trying to become doctors to try to make a change. Families that are supporting those individuals, please remember that they need you more than just a monetary support, right? It's a little bit more babysitting, as you may call it. You may gotta help them do some laundry. You may gotta make sure the food cut on the side. But once you've done the groundwork of making sure that they're grateful individuals, they're kind individuals, and they're doing it for the correct reason,
Mhm.
when they reach where their pinnacle are, everyone wins, right? Because
Yeah.
I'm sure, like, I'm not gonna ever forget all those who sacrificed for me to get where I am today. I can never forget, right? So it's very important to make sure that we have that that village around those persons also studying medicine. But now, when we talk about studying medicine and getting those individuals into that, we can look at the equity angle of it, right?
Mhm.
So this is just to give you an idea of why it's important to have that equity.
Mhm.
Earlier onset and greater severity, Black women tend to develop fibroids at a younger age. They develop a greater number of fibroids and experience larger fibroids with more severe symptoms
Mhm.
compared to their white counterparts and other racial groups. Looking at disparities in treatment recommendations. So, Black women are significantly more likely to be offered or steered toward a hysterectomy as a first line solution compared to less invasive options like a myomectomy, which is surgical removal of fibroids while preserving the uterus, a uterine fibroid embolization, or medication management, even when those alternatives may be clinically appropriate.
Isn't that scary? To think that if you're brave enough as a Black woman to walk into a doctor's office and you're prepared to advocate for yourself, you've done your homework, you know the things that you need to know, and you're able to make your case, and then they turn around and say, okay, so let's do a hysterectomy. What?
Especially if you're in childbearing age and you have yet to have kids, right? Where is the preservation of the opportunity of you being able to still have your family through childbirth,
Hmm.
right? There. That's why it's very important, as I said, to go where your representation is
Yeah.
understood, right? Go where your seen and your importance is given equally to anyone else that going, and not just equally. Go where your service is considered to be equitable,
Hmm.
right? When we start to take those things into consideration as we go day by day, bit by bit, movement by movement,
Hmm.
then we don't hear, okay, well, we just take out the whole uterus. Why are you telling the 26-year-old woman
Right?
have aspirations of being
A mom one day and having her own family.
exactly that she has to take out her? That is disgusting. It should never happen, right?
Especially when everything would say that a hysterectomy is the last line, because if we cannot treat, then yes, okay, then we need to consider having to remove it. But to take them straight to the end of the line, first and foremost, when all of these other options exist
Hmm.
and they don't need it.
Exactly. So very important that if someone comes and tell you, hey, but we got to take a hysterectomy, you say, oh, wait a second. So why can't I get a myomectomy? Why can't I
Yeah.
Um,
What's your rationale for not providing me with medication to manage? What's your rationale for not having me do the uterine fibroid embolization process?
mhm,
What
exactly.
is, yeah, why are we going straight to a complete removal? A
Of
complete removal. Why?
right? Yeah, exactly. So these are questions you have to take into consideration. Not let no one butcher you just because it looks good on their resumes and know that they've done 7 hysterectomies, right? And it's something as simple as that. It's like, oh, you know what? This is great. Um, I need to get an amputation done, so and I just take the foot. He'll survive. He's 70 years old. He could put a like no, or let's take it. And then she's okay. She could adopt. That's not how it works,
Mm-mm,
right?
mm-mm,
So we're looking at also a documented pattern, not an isolated experience. So broader research on pain assessment in clinical settings has repeatedly found that Black patients reported pain is more likely to be underestimated or undertreated than of their counterparts. Fibroid care is one clear, concrete example of that larger pattern playing out in a specific condition.
mm-hmm.
All right. So also, don't let anyone minimize your pain. Whatever you do, your pain is not to be minimized at all. All
Yeah.
right.
If it's real to you, it's real pain. Therefore, it's meant to be treated seriously.
Exactly. And then so we have also systemic framing and not individual blame. So the point of naming this isn't to villainize individual providers, many of whom are doing their best within an imperfect system. So though I'm saying that these providers may not know, it's not necessarily that they don't want to know. It's really and truly the case of that they were never taught.
Mm-hmm.
So we got to understand that a lot of providers, especially in North America, will never have the opportunity to treat or see a condition expressed in Black skin or from Black people while doing their
Until
typical
they're practicing.
pursuit until they're practicing. And then it's a whole new ballpark for them.
Mm-hmm.
So we have to remember not to just villainize their the providers itself. And I think I almost said vanillaize, because people may call them vanilla, but don't villainize the individual providers.
Yeah.
It's to name a structural pattern so listeners can recognize it. All right. So we need to ask better questions and advocate for ourselves when you get a chance to encounter it. Right. So you gotta make sure that don't just say that person, make sure that you come prepared. I always say that if you're going to do something and you're having all these things, write it down in a book. Write it down, right when it's at the tip of your mind, write it down. And bring that book to you and say, hey, I have all these questions. Leave a space under. So as you give me my answer, I'm gonna write it down. I want to document, I want to take it, I want to be able to travel with, understand, and be on the journey of my health condition, just as how you may see it there in your chart. I want to be able to have it for my own specific knowledge. So if anything that's happened to me on the flight and I can't speak for myself, I can tell some person here, look at this. These are the questions that I normally ask, and these are the
Mm-hmm.
answers I've been given.
Mm-hmm.
And most doctors will respect,
Every
right?
doctor should respect that because it shows that your patient is as invested and is willing to adhere to treatment as much as you are willing to treat them. So to be
Mhm.
able to have that opportunity and give them that information is something that physicians shouldn't be passing up because adherence to treatment is already hard enough for patients as well, right? So when they
Mhm.
are willing to take that moment and really get educated and learn about what they're living with to be able to give themselves the best chance of having a full healthy life, living with whatever condition they may have, that needs to be supported.
Exactly. So, and then we have to look at the consequences, right? So
Hmm.
especially when it comes to like the hysterectomy aspect. Hysterectomy is irreversible. You don't get to take it out and put it back in. It's not a carburetor. It's not an engine that you could put in store and side and put back in. It really is not. And it ends fertility. And there's a lot of disparities in how that option gets presented, right? And it also has recommended long-term consequences for family planning,
Hmm.
autonomy, and quality of life that ripple far beyond the initial treatment decision. So please, when we come, I know we touched on it, but when it comes to that hysterectomy, please be very, very cautious on accepting that
Hmm.
and not asking other questions. And you don't have to accept it, right? Just because that doctor decides to tell you, you have the right to go and answer 3 to 4 other different opinions,
Hmm.
right? And I'm not saying just 3 or 4. You could go to 12 if you need to, right? The number is infinite, but you have the right to ask more and not settle for what they're giving you, especially if you don't feel if it's correct for yourself.
1000%.
Mhm. So, as I said, this is a 4-part series for the month of uterine fibroid awareness. We're going to really go through um, parts of where we start recognizing symptoms and getting an accurate diagnosis. So, like what tests to expect when you're going through checking for fibroids, what questions you should ask your provider, and
Hmm.
how to describe symptoms in a way that is taken seriously. So this is not only an opportunity for, and we're going to touch on that in our next episode. It's not only an opportunity that we are just to talk about what fibroids do to you, but we're talking about, okay, we're here now, you may have it. What exactly should I do when I get in front of the doctor? Right. So
Hmm.
it's a little bit more a step further to making sure that you get the correct cure that you are deserved in those moments, right? And also what to expect for the would it rather be ultrasound, MRI, hysteroscopy, or whatever the case may be, what your results may seem, what actually is when you get these results, what you should expect to understand that. We also want to look at those treatment options across the spectrum, looking at that medication management, right? You're looking at the minimal procedures, of
Hmm.
the uterine fibroid embolization, the MRI guided focus ultrasound, surgical options like the myomectomy, and we want to talk a little bit about the hysterectomy, and how to weigh the trade-offs of each based on individual goals around fertility and long term health. And then we're going to talk a little bit more on some of the lived experiences, self advocacy. We're going to talk about endometriosis, right? We're going to talk about that hormonal imbalance as we go on further and further for all the different episodes and what you can do or the questions that you should be asking your provider to help you better your day to day life when it comes to fibroids. Those living with fibroids, those who may think that they have fibroids, those who have the possibility of developing fibroids, and those persons who live with person with fibroids would be able to share the information with them, and
Hmm.
also go with them to the different consultations. They could actually help them as well to describe what they may be feeling. So it's a packed month for July, I could say.
Yeah, we're
So,
doing a lot of educating this month. I think
all the
this is the first
education.
time that we've gone this route, and I think it's going to be really exciting for our listeners. So I hope that everyone is looking forward to these next few weeks.
Yes. I think we have to really be mindful
Hmm.
of what it is. Be mindful that the silence is real. Be mindful that giving a voice to it can actually make a change, right? Rather be as little as it is or as many persons that we may touch, to be able to hear what we have to say. And so for those listening, share with a friend, share with a cousin, a family member, somebody. Just say, hey, you know about fibroids? Well, listen to this on Sunday at 4:30 if you're not doing anything. If you're sitting down to have your evening, you should just plan to take a nap. I've heard that my voice puts people to sleep sometimes. So if you just
Yeah,
want
put
some
us on in the background.
right, so you could just hear what we have to say, because you never know. Some you may come for one thing and leave with something different. Right,
Hmm.
the information is going to be there to help us and to help us continue. So for me, I'm very excited for this series. How about yourself, Rachel?
I'm pretty excited. I've loved being able to share information with people and take medical terminology, medical concepts, all of that information that gets put out, helping it be repackaged and being able to share with everybody in a way that's simple and easy for everyone to understand because knowledge truly is power. And so to be able to share it, I feel very, very privileged.
Uh, Thank you, and I hope that as we go on and we get more questions coming in and whatnot, also too we can answer all of the doubts that you guys may have out there that you may not know what to ask. It's a free
Mhm.
space, it's a safe space. There are no stupid questions over here. The only stupid questions are the questions that are not asked. So please take the opportunity to ask your questions while we have the opportunity while we are here on online with you
Mhm.
to our program. So I think that brings us to another end of another episode of Black Up Unfiltered on Love Bay Radio, where truth, knowledge, and community come together.
Mhm.
Thank. Go ahead.
Stop stealing my line. Thank you, everyone, for joining us in these unfiltered conversations that challenge, uplift, and empower. Remember, your health is your power, your story is your strength, and your voice matters in every single space that you enter.
So stay connected, stay informed, and stay committed to your wellness journey. Until next time, keep reclaiming your narrative and protecting your peace. My name is Dr. Akeem Stewart, here with the wonderful.
Rachel Sinclair.
Thank you so much, and we'll see you guys next week.